is a dreadful disease affecting the mankind since time immemorial. Even though the government is making a lot of efforts for the treatment of tuberculosis, we are getting a good number of cases, getting repeated attacks, relapses, failure and default, and patients are not comfortable with the treatment. The government has issued a GO making tuberculosis a notifiable disease, thereby involving not only the government sector but also the private sector in getting the information regarding the treatment of tuberculosis. Now, let us try to examine and understand the present scenario of treatment, the regimens, and the need for new drugs from our panelists here, Dr. Maunika and Dr. DR.P.S from the local medical college. Now Dr. Maunika will tell us the present regimens and the treatment schedule being followed now under RNTCP. Over to Dr. Maunika.
We have two categories in revised National Tuberculosis Control Program, that is Category 1 and Category 2. It is also called NT and PT. In Category 1, we have intensive phase and continuous phase. In intensive phase, we will give 4 drugs 3 times a week for 2 months. And in continuation phase, we will only give 2 drugs, that is rifampicin and isoniazid 3 times a week for 4 months. In Category 2, along with Cat 1, we will give streptomycin for 2 months, without streptomycin for another month in intensive phase. In continuation phase, 3 drugs for 5 months.
Now let us hear from Dr. DR.P.S how the patients are responding, and is there a necessity for a new drug or not?
Yes, we need new drugs. The drugs what we are using now, they discovered 50 years back, and still now also we are using the same drugs. So most of the bacilli are resistant to these drugs. That's why there is a lot of treatment failure. Now we need a new drugs, and also number of tablets has to be swallowed by the patient is very much. So there is a difficulty for the patient to swallow the drugs. Next, the size of the tablet also more. Because of the tablet size, the patient unable to swallow the tablet. And the side effects by these drugs are more. So the patient unable to tolerate the drugs. For pediatric tuberculosis case, most of the children, the drugs they need are not the tablets, it is syrup form. Actually, we don't have the syrup form of tablet. Only tablets. It is difficult for the children to take the tablets. So we need new drugs in syrup basis. In that way, we can recommend new drugs for treating the tuberculosis patients.
Thank you, Dr. DR.P.S for giving us the information. And now, as really clearly stated by you, and we understand that the patients are feeling difficulty in taking several tablets in a go. That's number 1. And also the size of tablets also matters. So, and as I said, because the drugs are very old one and the bacilli have developed resistance. And also the patients are having some side effects, nausea, vomiting, so that they cannot tolerate the drug. So, in summary, we feel that even though the drugs are very effective, there is a definite need for new drugs in the scenario of number of tablets, size of the tablets, and also the duration of treatment, and also the especially for the pediatric form, the pediatric usage, the syrup form. So let us hope that our scientists will develop definitely new drugs, better drugs, which are more effective, more potent, less toxic, with less number of side effects, so that our community at large will definitely tolerate the drugs and have the full benefit of the treatment, and they will be cured of the disease. Thank you, Dr. Maunika, for being with us, and thank you, Dr. Prasad, for being with us and giving us valuable information. Thank you very much. Bye.